everyone. My name is Jamie Lamb, and today I'm presenting my poster presentation titled Back in the Game, Rebuilding Confidence After Injury. This presentation focuses on helping an injured athlete regain confidence and successfully returning to sport through exercise psychology principles and behavior change strategies. First, I will discuss the case study. I wonder if I can. Okay, my client Alex Thompson is a 20-year-old sophomore basketball player at Utah State University. During the final game of the season, Alex suffered a severe ankle injury that required surgery and a long rehab process. Although he has now been medically cleared to begin rehabilitation for exercises, he is hesitant to fully engage in the process because he's afraid of becoming injured again. Before his injury, Alex exercised almost daily and strongly identified as an athlete. Sports provided him with an important source of stress management, social connection, and personal accomplishment just throughout the game. Although, since his injury, Alex has experienced a significant decrease in physical activity, as expected. He also reported feelings of anxiety, frustration, low self esteem, and some depressive symptoms. To add, Alex has become socially withdrawn and worries he may never be able to return to his previous level of athletic performance. His primary goal is to regain confidence successfully, complete rehab and physical therapy, and return to participating on the basketball team. To guide this, I selected two psychological theories, self-efficacy theory and the self-determination theory. The first theory is the self-efficacy theory. Developed by Albert Bandura, self-efficacy refers to the individual's belief in their ability to successfully perform a specific behavior or task. Research has consistently shown that individuals with higher self-efficacy are more likely to initiate and maintain healthy behaviors. This includes exercise and rehabilitation. There are four primary sources of self-efficacy: mastery experiences, vicarious experiences, verbal persuasion, and psychological and emotional states. In Alex's case, mastery experiences will be promoted by beginning rehabilitation, or with small achievable goals. As Alex completes these small achievable goals, his confidence in his ability should gradually increase, allowing him to participate more and more and include in more and more. The vicarious experiences will be encouraged by connecting Alex with other athletes who have successfully recovered from similar injuries. Seeing others return to sport can increase his belief that he can do the same. Verbal excuse me. Verbal persuasion will come from coaches, family members, teammates, and healthcare professionals who will provide Alex with encouragement and positive feedback throughout the rehabilitation process. Finally, because emotional and psychological states influence confidence, Alex will learn strategies to not only manage these negative emotions associated with rehabilitation, and as well as anxiety. The second theory used in this intervention is the self-determination theory. This theory suggests that long-term motivation is strongest when I'm sick. With three psychological needs are satisfied: autonomy, competence, and relatedness. Autonomy refers to the feeling of control of one's choices and behaviors. To support autonomy, Alex will participate in developing his rehabilitation goals and will have input regarding certain aspects of his recovery plan. This helps give him getting excited and wanting to genuinely participate in his rehab. Competence refers to feeling capable and effective. By gradually progressing rehabilitation exercises and celebrating the small successes, Alex can develop a greater sense of competence throughout recovery. Relatedness refers to feeling connected and supported by others. Maintaining relationships with teammates, coaches, family members, and other injured athletes will help Alex feel socially connected during his rehabilitation process. However, the largest portion of this project is the intervention itself. The first intervention strategy I chose is goal setting. Alex will develop the SMART goals, which are the goals that are specific, measurable, achievable, relevant, and time-bound. Both short-term and long goals will be established. The short-term goals can include in competing in all rehabilitation exercises for the week, as well as long-term goals may involve returning to a full basketball participation. Those are just examples. However, Alex does get to have a say in that. The second strategy is self-monitoring. Alex will keep a rehabilitation journal to track exercises completed, pain levels along with that, emotional responses, and overall progress. Self monitoring increases awareness and allows both Alex and his healthcare providers to evaluate progress over time. The next intervention strategy is social support. Research has shown that social support positively influences motivation and adherence to the rehab programs. Alex will be encouraged to maintain regular communication with teammates and coaches and participate in support groups with previously injured athletes. Another important component is the psychological skills training. Alex will practice positive self talk, um, visualization, and self management techniques. Visualization will allow him to mentally rehearse what being successful and returning to competition will look like, while positive self talk can reduce any anxiety and improve confidence. The intervention will also include gradual exposure. The rehab activities will progressively increase in difficulty, beginning with simple exercises and eventually progressing to short, specific movements. The gradual progression should reduce fear of re injury and increase confidence in returning to basketball. The, the final step of intervention is the motivational interviewing techniques. These will be used throughout his rehabilitation process. This involves discussing barriers, exploring concerns about re injury, and helping Alex identify his own personal reasons for returning to physical activity. Motivational interviewing encourages the internal motivation as well as the long term behavior change that goes behind it. Despite careful planning, several obstacles may interfere with Alex's progress. One major obstacle is fear of re injury. This will be addressed through the gradual exposure and confidence building experience. Another obstacle is lack of motivation. The SMART goals and strong social support systems will help maintain motivation during recovery. I believe that the strong social support system will be the backbone to those SMART goals being successful. Alex may also experience anxiety or depressive symptoms. Counseling services and stress management techniques will be recommended when needed, as well as the social support being a huge help. Another obstacle is frustration related to slow progress. Celebrating small accomplishments throughout the rehabilitation can help Alex maintain engaged and motivated. Finally, social isolation may occur. Because Alex is no longer participating fully within his team, to address these issues, Alex will be encouraged to remain involved in team activities and maintain strong relationships with teammates and coaches. These will be his backbones to help him finally get through social isolation and get him to go through his rehabilitation process. Some barriers specific to the intervention may include thoughts such as rehabilitation won't help me get back to where I was, or if I push too hard, I'll get injured again. Alex may also feel embarrassed that he can't perform at his previous level or that recovery is taking too long. Addressing these beliefs through education, social support, and psychological skills and trainings will be essential. Replacing those negative thoughts with the positive self talk that we previously spoke about. Um, in conclusion, this intervention uses self efficacy theory and self determination theory to support injured athletes' return to sport. By emphasizing goal setting, self monitoring, social support, psychological skills training, and gradual progression, this intervention aims to increase confidence, reduce fear, and promote a successful return to basketball. Thank you for listening. My name is Jamie Lamb again, and this is my poster presentation. Thanks.